According to Dr. Chang, there are about 47% of patients who have gone on to develop a headache following a COVID-19 infection. Most people see that their headache symptoms clear up in about 2 months, and fewer experience symptoms longer than 3 months. So this takes us into a little background information regarding headaches. So the most common form of pain that we experience is a headache. And believe it or not, a tension headache is the most common type of headache that we will experience. So what is a tension headache? A tension headache is due to tight muscles in your shoulders, neck, scalp, and jaw, and it is often related to stress, anxiety, and depression. And you are more likely to experience a tension headache if you work too much, don't get enough sleep, miss meals, or use alcohol. So briefly, I'm just going to talk about the different types of headaches. So the first one is a hemicrania continua, which is a one-sided headache that can feel somewhat like a migraine. Then there's a primary stabbing headache, which lasts a few seconds and can occur several times throughout the course of your day. Then you have a primary exertional headache, which is pretty much what it seems, a headache that's caused by exertion or exercise. Then you have a chronic paroxysmal hemicrania, which is a sharp one-sided headache that can cause tearing or a congested nose. Then you have a medication overuse headache, which occurs from overusing pain medications for headaches for at least 3 months. So this headache occurs at least 15 days out of a month. And then you have cluster headaches, which cause severe pain on one side of the head and occur off and on for weeks over the course of a few months. Cluster headaches are associated with one or more signs and symptoms, such as tearing, nasal congestion, and nasal discharge. And these occur all on the same side as the pain.
Okay, what is the difference between a headache and a migraine? Knowing the difference can help you decrease the likelihood of future head pain. Migraines have intense pain with other symptoms associated with it, like nausea, ear and eye pain, pain at your temples, light sensitivity, and seeing spots. Whereas headaches are unpleasant pain in your head, which is associated with pressure and aching. Studies have shown people with a history of migraines are more likely to develop post-COVID headaches compared to those without. So if you want to know the difference, always remember that headache is the symptom and migraine is the illness.
Patients with a history of migraine also see an increase in migraine attacks after having COVID. Migraine attacks last for days, hindering your ability to succeed at work or spend time with your family. Symptoms like sensitivity to light, sound, and noise mean skipping out on social gatherings altogether. Certain activities of daily living that can be affected are sleep, morning routine, eating, personal hygiene, sexual activity, and functional mobility.
As we discussed, many migraine headache symptoms can affect an individual's ability to adequately perform their ADLs. These symptoms can also impact an individual's IADLs for the same reasons as we previously noted. This is reflected in the literature, which shows a decreased ability to perform certain activities for individuals with migraine headaches based on the assessment tools such as Migraine Disability Assessment Tests, or MIDAS. According to McGregor et al., 2004, migraines caused individuals from family, social, and leisure activities in the previous 3 months and 2.4 days from employment and school in the previous 3 months.
Take a brain break. Practice visualization and other mindfulness techniques. Examples of mindfulness techniques include meditation in group or alone. Go into a deep state of relaxation by breathing slowly, following the breath in and out while paying attention to the temperature, pace, and nuance of inhalation and exhalation. Imagine breathing, bringing in a wave of calm into your body, allowing it to settle where the tension is located in your neck, head, and face. Understand when and what triggers your headaches. Implement routines around the severeness of headaches. Some triggers, example stress, are very hard to avoid. If you are experiencing high levels of triggers such as stress or anxiety, even after trying self-management strategies, you may need further guidance from your family doctor. Figure out a solution that works for you often takes time and practice. Incorporate safe amount of physical exercise into daily routine that does not flare up your symptoms. Go outside, get some fresh air. Eat regular meals and drink plenty of water.
So now we're going to talk about some treatment options.
Lifestyle changes include maintaining regular sleep patterns, exercising regularly, eating regular meals, reducing stress, avoiding known triggers, and establishing daily routines. For trigger avoidance, triggers are specific factors that may increase the risk of migraines and headaches. They are different for each person. Keeping a headache diary can allow you to identify your triggers for your headaches. Over-the-counter medications are used to treat headaches quickly. Frequent use of these medications can lead to medication overuse headache. Migraine therapies are aimed at stopping symptoms and preventing future attacks. There are both pain-relieving and preventative medications, which can be obtained from prescriptions from your doctor. You want to consult with your doctor to determine which types of medications would be best for you. Factors that affect treatment include headache frequency and severity, if you experience nausea or vomiting with your headaches, how disabling they are, and any other medical conditions you have. Thank you for listening to our presentation. We hope you found the information on managing post-COVID headaches useful.